Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, everyone. My name is Marisa Hana Damayanti. My student ID number is 13086200027. In this session, I will discuss about the difference between bipolar and multiple personalities. For the first, we will discuss about bipolar. Bipolar is a mental disorder that makes the sufferer have an unstable mood, sometimes up or down. This disorder associated with mood swings ranging from depressive or depressive to high or manic lows. And this is the characteristic of bipolar. There is from very happy to very sad, from very confident to very pessimistic, and from very excited to very lazy to the activities. The most common characteristic of bipolar disorder is moodiness. People with bipolar disorder usually appear very happy, then appear sad or depressed for a period of time. Each, each emotional phase can last for weeks or months. Not only in adults, bipolar disorder can also occur in children. We will discuss about cause and effect of bipolar disorder. The exact cause of bipolar disorder is not known. However, it is suspected that bipolar disorder is the result of a disruption in natural compounds that function to maintain brain function, which is neurotransmitter. Disorder of the neurotransmitter itself are thought to be triggered by several factors such as genetic, social, environment, and physical. And for the effect of the bipolar disorder is like performance at school or work deteriorates, alcohol addiction to drug abuse, it can damage to social relationships, for example, with spouses, relatives, or other people. It also can make financial problems, and the worst is generating desire to attempt suicide. For the treatment, doctors will recommend the use of drugs or special therapy. To determine the appropriate method, the patient needs to do an examination directly to the doctor. And the next we will discuss about multiple personalities. Multiple personalities is a condition in which a person has two or more different personalities. Multiple personality is also called as dissociative identity disorder or DID, and is generally caused by traumatic experiences that occur repeatedly in childhood. Multiple personalities are often confused with schizophrenia, but the two conditions are different. Schizophrenics do not have as many personalities as people with multiple personalities. However, both of these conditions can encourage sufferers to commit suicide attempts. And this is the characteristic of multiple personalities. First, the sufferer will have two or more personalities which are different from each other or even contradictory. One personality can take over control of the sufferer's body and mind at any time, and is usually triggered by certain situations when the sufferer feels stressed, afraid, or angry. In psychological terms, the other personality is called by the alter ego. When the alter ego takes over the consciousness, the sufferer will become another person with a different name, age, gender, or trait. In fact, it is possible to sufferers to think that they are an animal. And the second characteristic, the sufferer will have amnesia. They don't remember certain events in their childhood or adolescence, especially traumatic events. Sufferers can also forget about events that have just happened, important information that is very basic, or abilities they have. Like bipolar disorder, the cause of multiple personalities is not certain. However, several studies have shown that people with multiple personalities have repeated traumatic experiences in their childhood. These traumatic experiences can be a torture, physical or emotional abuse, parenting style that can make children feel afraid of war and natural disaster. For the effect, multiple personalities can cause sufferers to have a high risk of experiencing complications in the form of the desire to self-harm or commit suicide, depression and anxiety disorders, post-traumatic stress disorder or PTSD, alcohol addiction, sexual dysfunction, drug abuse, sleep disturbance such as difficulty falling asleep, nightmares or sleepwalking, eating disorders, and physical symptoms such as several headaches. For the treatment method for multiple personalities is long-term psychotherapy. The goal of psychotherapy is to reconnect the entire divided personality. However, it should be noted psychotherapy only helps sufferers to understand the condition they are experiencing so that they can deal with and overcome these conditions. Psychiatrists can also perform hypnotherapy to help control abnormal behavior and make psychotherapy more effective. Doctors can also give antidepressants, antipsychotic drugs, or sedatives to treat the symptoms of mental disorders experienced by people with multiple personalities. So, the difference of bipolar and multiple personality is people with bipolar disorder do not have problems with their identity, such as people with multiple personalities. People with this condition will still be themselves, even though they experience problems managing drastic emotional changes. Meanwhile, multiple personalities are a disorder of a person when they have two or more personalities. This personality difference will certainly affect the thoughts, feelings, and behavior of the sufferer who appear at different times. People with this condition will have impaired consciousness, memory, and self identity. Okay, I think that's all from my presentation. I hope you all understand with my explanation. If there is any question, you can ask me in Q&A section later. Okay, thank you for your attention and see you later.